Aha. Great, we've got it now, Steph. So I do apologise, everyone. All yours.
All right. Sorry, just bear with me. Okay. All right. Hi, everyone. Thanks, Amanda, for the introduction. I'm very excited to present to you all today. So I apologise in advance. I have been sick this week with a cold, so I luckily have a voice today, but I am a little bit huskier than normal. But here we go. Exercise and physical activity for people with scleroderma. I'm just going to start with an acknowledgement of country. I acknowledge that I'm presenting online today from the lands of the Bidjigal and Gadigal people of the Eora Nation. I also acknowledge the traditional custodians of the various lands on which you all meet today and the Aboriginal and Torres Strait Islander people participating in this webinar today. And I pay my respects to elders past, present and emerging. Now, Amanda's already given an introduction on me, so thank you. I'll breeze past this, but as she already said, I have a personal interest in scleroderma, as Amanda mentioned. The photo below is my beautiful mum. She lived with scleroderma for 14 years, and unfortunately we lost mum 5 years ago. Just complications, as you can all imagine, and a cancer diagnosis in the end. So that's my beautiful mum down below and what my PhD was dedicated to. So I have just completed my PhD early this year. I did it on exercise for people with both scleroderma and lupus. As Amanda mentioned, I have systemic lupus myself. I've lived with that since I was 18 years old, so about 12 years or so now. Yeah, and Amanda already mentioned I work at Liverpool Hospital in the rheumatology department, a really great role. I get to work with all the rheumatologists and manage all the various research projects that happen in the department. This is some of the work that I have recently published in the space. Sorry if that's a little bit small for you to see, but there is some research coming out that I've done. I've looked at all the literature, all the exercise evidence in scleroderma. I've done a couple of different qualitative studies where I interviewed rheumatology practitioners, and I also interviewed people living with scleroderma. Some of you here today may have been in my study. And then I did a telehealth exercise intervention for people with lupus. So there's some of the research studies I've done, and I will talk through a couple of those in the presentation today, because I think some of the insights there are quite exciting and you'll all appreciate to hear them. So I'm breaking up this presentation today into 3 parts, so it's nice and clear. The first part, I'm going to talk a little bit about the overall research in scleroderma, and I won't spend too much time into this because I might lose your attention because some of it can be a little bit much. Then I'm going to break it up with a movement. So we'll all together do one exercise just to get our bodies moving. And then I'll go into the second part where I'll talk about my research that I've done in scleroderma and exercise. And then we'll do another movement together. And then the last part, which I'm sure you're going to really value, is my recommendations and advice for you about exercise. Now I'm going to start with this nice image here. So just take a moment, everyone, and I want you to think about this image. If exercise was a pill, it would be the most prescribed drug on the planet. Now, I want you to take a moment to think about what exercise means to you. Do you like it? Do you do it? What value does it have in your life? So I just want you to think about that for a moment and have that in the back of your mind as I talk through this presentation today. Now, I like to start with this part here because a lot of people don't quite know what an exercise physiologist is. We're sort of the new kids on the block. Most people generally know what a physiotherapist is because they've been around for a lot longer. But an exercise physiologist is an allied health professional, just like a physiotherapist, a psychologist, a dietitian. And we specialize in prescribing and delivering exercise for people who live with a chronic medical condition or an injury or disability. Services provided by an exercise physiologist are claimable under schemes such as the NDIS, under Medicare, My Aged Care, and also private health insurance. So if you do have any of those, you can certainly see an exercise physiologist. Now, a lot of people have the question of who should I see? An exercise physiologist or a physiotherapist? Really, it comes down to who you have access to. I know where I work in Liverpool Hospital, there aren't actually any exercise physiologists there. So really, the patients only have access to a physiotherapist through the hospital system. Again, a physiotherapist can prescribe exercise as an exercise physiologist can. So you really could see either one of us. A physiotherapist generally focuses more on acute care, and they focus more on manual therapy. So when you go and see a physiotherapist, you're more than likely for them to get their hands on you to do some sort of massage or manipulation type of therapy, where an exercise physiologist is a little bit more focused on chronic and longer term care. So you'll usually have an exercise physiologist for life. And we generally focus more on what we call active therapy. So really guiding you with how to move your body. So that's, I guess, the two key areas. But really, you could see anyone, and it's a matter of who you have access to. So part one, research in exercise and scleroderma. Now, this might be a lot on the screen, but I'll hopefully do my best to talk you through this. Now, part of my research was really about understanding the barriers that people with scleroderma face when it comes to exercise. And I'm sure many of you are going to read, I know they're really small on the screen, I apologize, but I think a lot of you will resonate with these. So in this particular study that I'm presenting to you, there was over 700 people that responded to this type of questionnaire. And that box in orange just shows you the participant characteristics. So they had a median age of 59 years old. 90% of the people were women, which is understandable given the 9-to-1 ratio of women to men with scleroderma. They had an average disease duration of about 10 years. 40% of the people in this study had the diffuse type of scleroderma. So what this shows in a nutshell is that a lot of people with scleroderma struggle to exercise because of one, fatigue. So I'm sure some of you are probably going to nod here. A very big barrier to exercise when you're trying to juggle your life and fit in exercise when you're feeling really fatigued. And as you all know, it's not just tiredness, it's a real heavy fatigue that makes it really difficult to do certain things in life. Raynaud's phenomenon was the second most reported barrier. And that really comes down to being so cold and finding ways to exercise that are comfortable for you and that don't trigger your Raynaud's phenomenon. Joint stiffness and contractures. So that was the third barrier. Shortness of breath, gastrointestinal problems, difficulty grasping objects, particularly for those that have the sclerodactyly in the hands, and pain. And then there were several other barriers there if you can read the small print. There were some other barriers to engaging in exercise, which some of you will also resonate with. A lack of motivation and difficulty committing to exercise. That was one of the social barriers reported. Feeling embarrassed or discouraged due to your physical abilities. And also maybe for some of you who have had changes in your appearance, there might be a feeling of embarrassment maybe going to a public gym environment. And then other things like fear of getting injured or having a very long recovery time after you engage in exercise. So they're just some of the barriers that I was really interested in as an exercise physiologist, because how am I going to get people with scleroderma to exercise? I need to really try and break down these barriers. Now, this is another study that looked at some more barriers to exercise. This was from a really good researcher named Peterson in Sweden. So this was a smaller study where he interviewed people. There were 16 people in this study, averaged between 24 to 73 years old. Again, majority women, and the majority of people in this study had the limited form of scleroderma. Now, some of the barriers here quite similar. So disease consequences. So people were afraid of exercising because of some of the symptoms, such as the fatigue, the joint contractures in their hands, the sclerodactyly in their hands, and Raynaud's phenomenon. So again, very similar to the previous study. Another interesting one was risk of worsening your disease or some of your symptoms. So a lot of people in this study said, I'm scared to exercise because I'm scared that it will trigger off my disease. So that was another barrier that was reported here. And then some non-disease related barriers such as lack of motivation, lack of time, trying to fit in exercise when you've got other things in life that you have to do, like raising a family or going to work. So there were some other barriers. Again, you may resonate with some of these. Now, this is looking at how we can facilitate exercise. So looking at some of these barriers, how do we break these down? And this study broke this down really well. And I put it into two clear parts here. So the first one was people with scleroderma said we need self-confidence in exercise. So people said that they valued knowledge and experience about how to exercise, recuperating after exercise, working out at home, using things like exercise gloves, special grip techniques, special shoes, and having supplementary oxygen while exercising. So these are the things that made it easier for people to exercise. And then the other interesting part was having education and support from your healthcare team. So they really valued their doctors giving them information about exercise, or even an exercise physiologist presenting to you about exercise, motivational support. So I think these support groups and knowing other people with scleroderma is really valuable when it comes to exercise. Ensuring that exercise is supervised by a professional. And they also mentioned group exercise or exercising with a friend was something that would facilitate them to exercise. So there's some of the barriers and facilitators that I thought was worth sharing with all of you today. Now, this is just some of the evidence in exercise. So this is the stuff that I've been looking at over the years. There is not much evidence on exercise in scleroderma. As you know, it's a rare disease, so there hasn't been much exercise trials done in this space compared to other more common diseases. But what we do know from the evidence is that exercise does improve your muscle strength and function, and it improves your aerobic capacity, which is very important for scleroderma, as you know, because you can get wasting away of your muscles over time. And for anyone that has lung involvement, improving your aerobic capacity is really, really essential to counteract some of the lung changes that you're experiencing with scleroderma. And then some other exercise benefits is it improves oral aperture. So as an exercise physiologist, mouth and hand exercises is a little bit out of my scope of practice. This would be more a hand therapist or an occupational therapist or even a dentist to give you some specific mouth exercise. But there is some evidence that shows that it improves your oral aperture. Now, some more evidence in exercise, just really reiterating the benefits of exercise. It does improve your aerobic capacity again, your quality of life. So just your feeling of well-being in life. Exercise can certainly increase your endorphins and make you feel better, especially when you're dealing with such a debilitating disease. Exercise improves muscle strength, your muscle endurance, and your muscle function so that you can participate in life activities more comfortably. And it also reduces fatigue, which is really, really important. So in these studies, again, I'm sorry if this is a little bit small for you. I can certainly share this with you if you like. But in a nutshell, I just wanted you to all see the type of exercise that people were doing in these exercise studies. So on average, the exercise session went from about 30 to 50 minutes in duration. Most of the participants did exercise for about 2 days a week, and it went for about 12 weeks. And then a lot of the exercises were either walking or cycling on a stationary bike or cycling with your arms. And then there were some really functional strength exercises done as well. Now, this was another really interesting study that just came out last year. This is a big group of researchers, again in Sweden. Peterson et al. Was the researcher that I presented earlier. And they sort of came up with lots of evidence around exercise, and they put it all together in a really big research paper. But there's a lot to take out of this. But essentially what this diagram on the right shows you with the person is that exercise has lots of benefits for all the different manifestations that you get with scleroderma. So it improves your oral health, your quality of life, your aerobic capacity. It helps with circulation, particularly for that Raynaud's phenomenon and the cold you experience in your hands and feet. It helps with digestion. It helps with muscle strength and endurance. So there's lots and lots of benefits of exercise. So just going back a slide, one of the nice things that came out of this study was they put some nice guidelines to exercise here, which essentially says keep moving. So if you're not someone who really likes exercise, that's okay. As long as you try and replace your sedentary movement with keeping active. So going for a walk, getting up and down off your chair regularly, walking around the shops. So just keep moving. If you're not one to go to the gym or do a structured exercise session, it's just as important to keep moving. And then other things like exercising for life. So making sure that you're engaging in some sort of supervised exercise that may be home-based. So maybe it's doing an online exercise class or exercising with a friend. Now, I'm just going to pause here for a moment. Now, on my screen, unfortunately, I can't see you all, but I'm going to have to just flick my screen away just so I can see you all. But I just want to get everyone up and moving for a moment. So for those of you that are watching this recording from home at another time, you can certainly get involved with this. So as you can see the little man on the screen, we're just going to get our legs moving. So if everyone would like to just sit on the edge of their chair for a moment. Now, not everyone can do this, I understand. But if you can and you're able, let's give it a try. So we're going to stand up and down 5 times together. All right. So when you're ready, just on the edge of your chair, we're going to come up off your seat. And then we're going to sit back down. And we're going to come up again. And just try this, everyone, in your own time, 5 times. Just to get those legs moving. All right, excellent, everyone. It's good to break up sedentary time and do some movement. So hopefully everyone was able and found that exercise quite comfortable, but I just wanted to break up the presentation a little bit. All right, so let's continue. Now, that's a great exercise, everyone, that you can do at home. So up and down off your chair. Now, this man has obviously got his arms free, but for some of you, you might find it more useful and beneficial if you actually help yourself by using the arm rests. All right, so now I'm going to move on to my research on scleroderma and exercise. So this is one of the big papers that I'm working on at the moment, where I'm pulling all the evidence of exercise into one big study. So this is still going. So far, we've included 48 studies of exercise and physical therapy. So I'm working with a big team here in the US and looking at all the evidence on exercise and physical therapy. This may or may not be ready by the end of the year, but I'll certainly share it with you all once it is. Now, this was a great study. I interviewed rheumatology practitioners about their views of exercise for people with scleroderma and lupus. So I did this a couple of years ago. It was one of my first PhD studies. And what I did was I interviewed one-on-one practitioners. So I had a little advertisement flyer and I got practitioners' interest to participate in this study. So this was just a rough structure of what I asked. So tell me about your experiences of working with people with lupus or scleroderma. What are your experiences and thoughts about exercise for people? What do you think some of the barriers that people may face with the exercise? And can you tell me about any changes you have seen with your patients with scleroderma or lupus? We had 17 people participate, 17 12 rheumatologists and 5 rheumatology nurses. The average years of experience or practice that the participants had was 26 years, so lots of experience. We had a mixture of practitioners who were in a public setting and a private setting as well, and majority were from New South Wales, although we got a few from other states of Australia as well. Now, overall, these were the themes that came out of the interview. So a lot of the rheumatology practitioners said that exercise is very beneficial for people with scleroderma and lupus. They did identify some barriers to exercise. Practitioners did say that they were confident in promoting exercise to their patients, but they did lack time in their consultations and experiences in providing exercise prescription, which is understandable because there's so much else that doctors have to talk to you about in their session that exercise is normally one of the last things that may come up. They had some very limited concerns about exercise, and this was mostly to do with anyone with, say, pulmonary arterial hypertension. They did emphasize that exercise needed to be really supervised and gradually paced. And they also mentioned that they had some concerns for people with really particular joint contractures, just to make sure that they were using the right equipment to exercise. And then they also offered some facilitators to exercise. So here's some quotes I thought you'd find very useful. So benefits of exercise. This is a quote from one of the participants. For a patient with chronic disease, I think it's even more important for them to exercise because when they have joint pain, lung or heart involvement, having good fitness and strength makes it easier for them to cope with their illness. I think exercise is good for everything, and exercise is really underrated. Barriers to exercise. I find people are more ready for the passive type of treatment. They are more ready to see the podiatrist to cut their nails than they are to see an exercise physiologist, physiotherapist, or a dietitian because they involve more active self-work. I wonder if any of you can relate to that one. I think the biggest barrier for exercise in scleroderma and lupus is that there is no system set up for these patients to continue exercise long term. I don't think the health system is properly set up to help patients get into good habits with exercise, especially in the long term. So you may relate to this. Exercise, seeing an exercise physiologist or physiotherapist privately can become quite costly. And they're really, aside from having your 5 subsidized visits with Medicare, there isn't much supported exercise financially. So it is, I understand this particular quote that came from one of the participants. Some people might just be worried that pain equals doing harm or damage. And I can assure you all by the end of this presentation that that is certainly not the case. Now, exercise prescription. So from a rheumatology perspective, time offers a big barrier. So imagine your consultation with your rheumatologist. You have maybe 15, 20 minutes, sometimes 30 minutes if you're lucky, and there's so much to talk about your disease that they don't have a lot of time to talk about exercise with you. As rheumatologists, we are not well trained in knowing what specific program is good for what condition, but I think our role is to remind our patients to exercise and identify anyone who's not exercising and then refer them on. So I thought that was a really good quote. I think I would like some guidance around exercise, even if it's leaflets or practical steps to get people started, or how to use an exercise physiologist. Now, safety concerns of exercise. The main concern is that we have guidance for these patients and that can feel like they're exercising in a safe environment. I wouldn't have any concerns that exercise would exacerbate the disease. So that's a really promising quote. And we know pulmonary hypertension is a serious condition. And for that reason, vigorous exercise training or exercise that is not monitored is not suitable for these patients because they are at high risk. Now, this was a very serious quote, but just one to emphasize that it's very important that if you are engaging in structured exercise, that it's very important that you are supervised. Now, some facilitators. It does need to be long-term. It does need to be forever to improve your strength and your fitness. And exercise is a treatment, which I thought was really nice to hear. Patients with diffuse scleroderma need more guidance, supervision, and support. And I do think supervision will be really important, particularly if somebody had lung involvement. And making sure patients are resting properly, not going too hard, and not doing anything that they are not comfortable with. So there's some of the quotes from the practitioners that I thought hopefully that you found quite interesting. So what we learned from that was rheumatology practitioners highly value exercise for you, which is really, really promising. Rheumatology practitioners suggest that they need more information and options for their patients to engage in long-term exercise. And this is certainly what I'm really trying to do. And this is where I came up with my team in the rheumatology department at Liverpool Hospital to come up with a scleroderma clinic. So we are starting in July in Liverpool Hospital, a dedicated scleroderma clinic where all the practitioners work together of an afternoon and exercise is embedded in that clinic. So providing that information about exercise really helped to bring this together, certainly in Liverpool Hospital and hopefully in more hospitals around New South Wales and Australia. All right, so the next study, this is where I interviewed you. So I wanted to find out what your views of exercise were. Now, I did the same thing, but this time I did it as a focus group. So I had a group of about 8 people engaged in conversation, and we did this on Zoom. We had 23 people. Some of you in this talk today or listening online may have been involved, so thank you again. And they're just some of the characteristics. So on average, 59 years old in the group, a mixture between diffuse and limited, mostly the diffuse form. A mixture of those who've had it for more than or less than 10 years. Majority of people in the group had lung involvement. And in total, we had 3 focus groups. We had 8, and then 7 in the last one. Now, this is just an overall slide that I put together. It's called a thematic schema that looked at all the themes that came about from the study. But I'll talk through each of these individually. So here we go, barriers to exercise. I'm going to talk through some of the quotes that came up in the study. So these are the things that you all told us. The problem is if I went to a gym, I wouldn't be able to grip things because the weakness and constrictions in the hands makes it really difficult to do stuff like that. I've got ulcers on my feet, so I can't do meaningful walking. Things were going really well until I started feeling really breathless. If I walk a block, I'm panting really hard, so I'm not exercising anymore. I find it really unpredictable as well because some days my legs feel like lead. So I just want you to take a moment here and think about some of the barriers that you face when it comes to exercise. Now, on a positive, here's some of the benefits of exercise that you told me. So physical exercise for me is parallel to my mental well-being and my emotional well-being. Someone pointed out something really interesting, that they were participating in an exercise class that would start off with a breathing exercise in the beginning and at the end. And they found that for the lung fibrosis, this was really helpful. Someone also said that if I don't exercise, I get really fatigued. We know that we need to move our joints and everything. And if we don't, we feel the seizing up and the tightening. So again, emphasizing that exercise is really good for the joints. Now, something that I took out of this study was a perceived change of your ability to exercise now compared to when you were or before you were diagnosed with scleroderma. And some of you are probably going to nod to this one. Prior to being diagnosed, I could walk for 3 hours without being sore or anything afterwards. What I experience now is the swelling and the tightness in my legs. I don't have full movement in my knees and my ankles. I found that I'm not as strong as I used to be. And I have slowed right down with my gardening. I used to swim a lot. It was my favorite thing. But once the Raynaud's came, you can't. So again, this may resonate closely with some of you listening today. And then the most important thing is these are the facilitators that I got out of this study. And this is all coming from you with scleroderma. Now, someone said something really interesting, that where they exercised, the girls or the trainers would always put the heaters on 10 minutes before our class started. So by the time I got there, it was warm. So this is something that I have really taken away from this study as an exercise physiologist, to make sure that the room is always at a comfortable temperature before you start. Someone even suggested going to YouTube and typing in chair exercises, and you'll be surprised what comes up. So a few people in the group really liked exercising from home and doing it seated on a chair. Someone also said working out what exercises to do and where to put your hands, and being appropriately clothed adds to the benefit of exercise. So ensuring that you turn up to exercise already clothed, appropriately clothed and warm. Now, what we got out of this study is that you all, people with scleroderma, so you in this group today, experience some barriers to exercise, but you do know that exercise is beneficial and it does help you. So what we need to do together as exercise physiologists and people living with the disease is to break these barriers. So some of the key things is ensuring that you're exercising in a comfortable environment, a comfortable, temperate environment. Using modified equipment. So there's 2 images on the screen that shows you what this looks like. Making sure that your exercise is individually supervised or supervised as a group, and that it's modified to suit you. And also accountability and motivation. So whether that is exercising in a group all together, exercising with a friend, it's really important that you do keep accountable. So that brings me to the end of part 2 of my presentation, which was talking about my research. And just so that I can take a breath, here's a nice little exercise that you can do just marching on the spot. You can even do this in your chair. So while you're sitting in your chair, everyone, let's just do it seated. I just want you to lift your knees up like you're marching on the spot. So just take a moment, everyone, while I take a quick sip of water, marching your legs on the spot, or if you'd like to do this standing, you can do it just like the girl on the screen is doing. All right. Hopefully everyone's going okay with the presentation. I'm doing my best. Try not to cough. But I'm going to move on now to the last part of my presentation, and I'm doing very well for time to allow for questions. So great. So part 3 of my presentation is my exercise advice. I'm just going to fix my screen up. All right. My recommendations and advice following all the research that I've done, and also my experience as an exercise physiologist. So the first consideration for you all is the environment. It's very, very important. I've showed you already all the barriers that you all face to exercise. So it's important that you ensure the environment that you're exercising is a comfortable temperature. Very, very important. That is going to make you more likely to engage in safe and effective exercise. Wear warm clothing. I don't need to tell you this. I think you all know this yourself, that anytime you exercise, you need to make sure that you're appropriately clothed, whether that's wearing gloves, turning up with layers. Don't worry what people think of you. Make sure that you're warm. Very important. If you have capacity, make sure you just slightly heat the room prior to exercise, or ask your instructor to. Don't be afraid to say to your instructor, can you please make sure the room is a little bit warmer? Or for some of you that are listening to this thinking that that warm temperature is not quite for you, that you need something a little bit cooler, then tell your instructor. Don't be afraid to tell them what's going to make you more comfortable. Use blankets and towels. When you go to your exercise class, or if you're exercising at home and there's a surface that's a little bit too cold, pop a blanket on it or pop a towel on it. You're going to be a lot more comfortable and less likely to flare up your Raynaud's if you keep it warm. And another thing that I've learnt from working with people with scleroderma is avoid being positioned in front of cold airflow. So if you're exercising, make sure that there isn't an aircon or a window directly in front of you that may trigger your Raynaud's, particularly if you're someone that is triggered by that. So make sure when you're exercising that you position yourself in the right place. So that's the first thing that I'm going to talk about for you, and I want you to take away is the environment is really important for you when it comes to exercise. The second thing is equipment. So in this image here, now some of you may know this beautiful lady that's depicted in the photo. She did give me permission to use her images. I've always used this lovely lady in my presentations. I worked very, very closely with her as her home exercise physiologist, and her family has also given me permission to continue using this, given that this lovely lady has recently passed away. So this was some of the equipment that I used to make it more comfortable. So rather than using your hands to grip things like this is a TheraBand, you can use little straps around your wrist so that you can still do exercises like pulling the resistance band without making it really uncomfortable for your hands. Another really good one is weighted straps, and I'll show you in the next couple of slides what that looks like, so that you can still use weight to give your muscles extra resistance. For some of you that can't get down onto the floor very comfortably, you can find alternatives. Use your bed, use your lounge if it's comfortable, or you can purchase a nice cushioned mat from Kmart, where it's sort of a little bit thick, and it comes in like it folds into 3, and you can lay that down on your floor. I used to do this with this lady next to the couch so that she could comfortably get down onto the floor, onto the mat, and then get back up using the support of the lounge and using a little bit of her forearm to help lift off the floor. And I was, of course, there with her, so that made it a little bit easier. And then the other thing to think about with exercise equipment, particularly for any of you who go outside to exercise, is really make sure that the equipment is sanitized. Some of you may be on immunosuppressant medication or biologic therapies, and it's really important that you protect your immune system and sanitize all the equipment, or tell your instructor to. So don't be afraid to tell them. So that's the next thing that I want to emphasize, is equipment is really important. So here's some modifications of equipment just so that you can see. So again, you can see that the TheraBand is connected to the weighted strap to do different types of exercises. These are the weighted straps that you can put around your wrist. You can purchase these from places like Decathlon or Kmart, and they just go around and you strap them. And so you don't have to grip anything with your hands. And they do come with about 2 to 4 kilos of resistance. You can do aerobic exercise such as a bike. So you can see here that we had a bike set up at home. So this is something that you may want to consider using. And again, you don't have to use your hands. You can use your legs to increase your heart rate. For some of you, there's also a bike that you can use with your hands. For some of you that don't have sclerodactyly or problems using the hands, you can get a little an arm bike that you sit on your table and you can cycle with your arms as well. You can see here that we're using the bed, which was a little bit more comfortable when lying on the side, particularly if you've got any ulcerations around your hips, or if you have any sore joints around your hips. The bed's a little bit more comfortable to use to do exercises like the one showed below, which is called a clam, where you're pulling the resistance band with your knees and getting some resistance in your hips. Now, the third key takeaway is energy. So it's very, very important that you find the right balance of life and exercise. This is where an exercise physiologist can work with you to really find the balance in your week, to see where exercise fits in nicely. Choose exercise sessions on appropriate days and times of the day. So everyone in this room today listening, some of you prefer the morning, some of you prefer the evening. Everyone is very different. So choose the right time of the day that suits you. I've had people that are early risers that prefer to get their exercise done in the morning because that's when their energy is higher, whereas some people quite the opposite and they really prefer the late night exercise. And the other thing I want you to think about when it comes to exercise is ask yourself, how many spoons do I have today? So some of you may have heard of the spoon theory. I use it all the time with exercise. So essentially, for those of you that don't know the spoon theory, somebody without a chronic disease has an endless amount of spoons, spoons being an analogy for energy. Whereas someone like yourself or me with a chronic disease, we have a limited amount of spoons that we can use in our day. Let's say 15. Each spoon that you use is a task and it requires energy. So for example, you get out of bed, that's 1 spoon. You get dressed for the day, that's another spoon. You take your medications and you sit down for breakfast. That might take 2 spoons. You go and walk your dog or do an exercise session. That might take 3 to 4 spoons, and everybody will require a different amount of spoons for exercise. Then you go to work, or you take your kids to school, or you go out and do your grocery shopping, and that takes another 3 spoons. So you can see here that your spoons are very, very quickly adding up. And you might use your 15 spoons before you even get to the end of the day, and that's when you hit that plateau period where you're completely ridden off for the day and you need to lay down. So again, this is why it's really important to find your balance with exercise. Choose exercise that you enjoy and that require maybe a little bit less spoons, and think about your day. If you've got a really big day planned, that's probably not the best day to fit in your exercise. So choose a day where you've got a little bit more capacity or a little bit more spoons available to exercise, or you choose an exercise that takes less spoons on the day that you have a lot more on. So just something to consider. The next one is making sure that your exercise is individualized. You don't need to do what somebody else is doing. Never compare yourself to someone else. Choose exercise that is suited to you. Choose exercise that you enjoy. Now, not everybody loves exercise. So it's really, really important, if you don't love it, to find something that you love. There's got to be something. Is it dancing? Is it swimming? Is it going for a walk? That's what I did this morning. I went for a beautiful walk along the coast here of Sydney. That's what I love. It's what lifts my spirit. So you need to find something that you enjoy. I would emphasize that it needs to be supervised. Now, I'm going to talk to you about the difference between exercise and physical activity in a moment. But if you're doing exercise, I do encourage that it's supervised, particularly if we're talking about specific strength exercise. So we're going to talk about how you can find a supervised exercise practitioner in a moment, but that is important. Start slow and gradually progress. Don't jump straight into something. Don't say, okay, I'm going to exercise this week. I want to do 4 sessions and they're going to be 60 minutes long. Start slow. Start with very, very small bite sizes and then increase your capacity. And for those of you that do have lung or heart involvement, I do encourage you to monitor your oxygen and your heart rate if you are exercising on your own. You can go and buy yourself a little oximeter, where for some of you, it may be suitable to pop it on your finger and it gives you a reading of your oxygen. There are other ways. I think there's a monitor that you can put around your forehead or your ear to get a reading of your oxygen capacity and making sure that it's, again, everyone has different capacities, but generally over 90 to 95% is a good reading of your oxygen. Now, just remember that some movement is better than no movement. So really try and find something that you enjoy because that's better than nothing. Now, how to get started with supervised exercise. So I want you today to think about going to your GP or your specialist and asking them what you're eligible for. Now, Amanda here has done some really good webinars, I believe, or does a lot of offers a lot of support on how to apply for NDIS. So if you are suitable, then I think it's worth talking to your GP or specialist about getting started, because that does take away the financial burden of seeing an exercise specialist. For those of you that don't want to go through the NDIS or aren't eligible, that's okay. There are other avenues like Medicare, although Medicare does really only give you 5 subsidized sessions with an allied health professional, which isn't a lot, but it is something. It is a starting point. Some of you who are above 65 might be eligible to apply for My Aged Care, and I highly encourage you to do so because it does offer some subsidized exercise costs depending on where you sit in your assessment, whether it's Commonwealth support or whether it's level 1, 2, 3 or 4, you will get some subsidy. And the other thing to consider is private health insurance. So for some of you who don't fall under any of those schemes and you do have private health insurance, if you do see an exercise specialist, you can get a little bit off your session through your private health insurance. So they're just some things to consider to make it more accessible and more affordable. The other thing to consider is if you do see a rheumatologist or immunologist in a hospital, they may have a physiotherapist, or if you're lucky, an exercise physiologist in that hospital setting who may be able to see you for free exercise as part of the public health system. So ask your GP or specialist. Now, we always talk about exercise, and I assume people know how much to do, but I don't know if everyone really does know. So I want to share that information with you. Now, at the start of the presentation, I did say that exercise is like a pill. Now, when you take your medication, let's say you're on mycophenolate, for example, the doctor gives you a dosage. They don't just say, okay, go and take your mycophenolate, full stop. They will tell you, take your mycophenolate this many times a day, take this milligram and take it daily. So there's a dose. Now, exercise is the same. Exercise is like a pill and there is a dose. So in your week, exercise or physical activity, I should say, should be done between 75 to 150 minutes a week. Now, the beauty about that is you can really decide how much you do to accumulate to that 150 minutes. You might do 10 minutes here, 10 minutes there, 20 minutes tomorrow, 30 minutes the day after, and that all accumulates to 150 minutes. So a key thing that I do with some of the people that I see is I give them a diary, let's say on Excel, and every day they put in the amount of time that they do, and then at the end of the week, it automatically tallies up how many minutes they've done. And the goal is to always try and achieve 150 minutes. And that can be anything: going for a walk, doing gardening, walking up and down stairs at home. Anything that lifts your heart rate is considered activity. Playing sport, doing a dance class, anything that you do that lifts your heart rate can be included in that 150 minutes. So that's the good news. And that's the whole story about doing something is better than nothing. Get your body moving, get your heart rate lifted, that counts. Okay, so that's really important, and I want you to take that away today. Write on a piece of paper and do your own little tally and see if you can get to 150 minutes. And that might not be this week or next week. Maybe you start with 75 and then very slowly build your way up to the 150. Now, the new guidelines have lifted this to 300 minutes. Now, that might seem a little bit overwhelming for some of you. So I want you to just start with 75 in your mind, build to 150, and then know that in time that you can get to that 300 minutes of activity a week. Now, the second image that you see on the screen, I want you to think about this as more supervised exercise. Now, the guidelines say that we should do muscle building activity at least 2 days a week. Now, for a lot of people, this is what we're lacking. This is what should really be supervised for people with scleroderma, because doing strengthening exercise is quite complicated. As you could see in some of the images that I presented earlier, it does take a lot of modification and working out how you can get the most out of it. So this is where I highly recommend seeing an exercise specialist. So this requires any type of exercise that is structured and build your muscle. So the exercise that I got you to do at the start, getting up and down off your chair 5 times, that's a muscle strengthening exercise. So that is something that I think it's really important for you to speak to your GP or specialist about and see how you can engage in some type of strength exercise. Now, physical activity and exercise are 2 words that are used quite interchangeably. What I want you to understand is that physical activity is sort of the broad umbrella term for any movement. This is that 150 to 300 minutes that I'm talking about. So any type of activity that increases your heart rate in some capacity. It could be walking, gardening, playing sport, dancing, any type of movement. That's physical activity. And I want you to try and think about that 150-minute target. Exercise is a subset of physical activity that is more planned, more structured and repetitive. That I want you to think about the pill. That has a specific dosage. Okay, and that's what I'm going to talk through the next couple of slides about. So exercise dosage. It's like that pill. We have an acronym called FIT. Frequency, how many days a week do you do it? Intensity, how intense, how strong, how much do I have to increase my heart rate? How long should I do it for, and what type should I do? So frequency, as I said, in general, think about a minimum of 2 days. I think if you can try and do a minimum of 2 days a week of any type of strength or aerobic exercise, I think that's great. And again, that can look very different for all of you here. It can be 10 minutes, it can be 30 minutes, it can be anything that you enjoy. 2 days a week is normally the targeted frequency of exercise. Now, intensity, this is again something that your exercise professional needs to work out with you, and there are tests to work out what intensity you should be exercising. But as a takeaway, I think the most important thing to remember is if you can talk while you're exercising or moving, that is a good intensity. That is what we refer to as moderate intensity. So if I asked you on a scale of 0 to 10, how intense or how hard does this exercise feel? Somewhere between 3 to 4 is good. So if there's something that I want you to take away is if you can go for a walk with your friend and have a conversation, then that's good. Now, exercise time, again, this is really a personal preference and really about how much you're capable of doing. So as long as you're accumulating to that 150 minutes, whether it's 10 minutes, 30 minutes, or 60 minutes, that really is up to how much you can tolerate. I want you to think about exercise time as an accumulation throughout the week. I think that's the easiest way for everyone to understand how long should I engage in exercise for, because that is really, really individualized and personal. It's a matter of how much you can fit in based on your busy schedules, but also how much your body can tolerate. So I want you to think about time as an accumulation over the week. Type of exercise is really personal again. Do what you love. Some of you may already be part of a Pilates exercise session or yoga. I'm part of a yoga studio. I do yoga 2 days a week. I love it. It does wonders for me. So it's really about finding what you love. I also love walking and running. So that's what fills up my cup in life. Some people love swimming. Some people love bike riding, or they may have a bike at home that they use. So really, when it comes to type, I think it's about finding what you love. But as a general rule, we should be doing some type of exercise or movement that involves using our muscles, using our joints, and using our lungs. So as long as it sort of fits into those categories, then you're doing something right. So tips to get started with exercise. I really encourage finding an exercise physiologist, speaking to your doctor to find out what you're eligible for, so that you can see someone and they can guide you through this, that you don't have to do all the thinking. You can get a specialist to do that for you. Choose exercises or movements that you enjoy. Can't encourage that enough. Set yourself some short-term goals. Is there something that you would like to achieve? Is it being able to get up and down off a chair comfortably? Is it being able to get down onto the floor to play with your grandchildren or your children? Is it being able to walk the city to surf? I know that's a big one, but whatever it is, everybody has different goals. I want you to set yourself some goals, okay? Because that keeps you accountable to exercise. If you have something you want to work towards, that gives us more motivation to do it. An example for myself is when I book myself into a running event, it motivates me to train. It motivates me to go for those walks and those runs to achieve that goal. Start small and gradually build up. So today, start with 5-10 minutes of something, any type of movement, and gradually build yourself up to that 150 minutes in the week. And more importantly than you all know this better than anyone, is listen to your body. Ask yourself, how many spoons do you have to give to movement today? And if you're not feeling up for it, then that's your body telling you today is no good. Maybe tomorrow is better, or maybe this afternoon is better. So listen to your body and your symptoms and make sure that you're doing what your body needs. So another little movement idea here is calf raises. And this is an example of something that builds strength in your muscles. You can do this seated or you can do this standing. So I'm going to get you all, even on your chair here, is just lift your heels up and down off the floor. And if you do this 10 times in a row, that builds your muscles. All right, so this is a nice exercise. It's also good mobility for your ankles. So it fits into that mobility type of exercise as well. And that is all I have for you today. I know that's probably a lot of information. Exercise is a very big topic. Took me over 3.5 years to complete a PhD in it. So there is a lot of information, but I'm hoping that in this webinar today, I have shared some of the evidence behind exercise and some practical tips to get you started with exercise. So opening the floor now to discussion and questions.